You are tuned into the Dr. Tyna Show with Dr. Tyna Moore. For more, visit drtyna.com. On this episode of the Dr. Tyna Show, I'm going to be sharing with you something very personal that I have been dealing with for the past 3 weeks. And I thought I might as well come out and just talk about it because it's not getting any better. And that is, I had a voluntary plastic surgery done. I had an upper blepharoplasty done, which is where they take your upper eyelids, which mine were very hooded, and it was starting to impact my vision on this side. And it was definitely starting to make me look old AF. And they cut off a piece of your eyelid and they sew it back up. So there it is. The reason I'm having trouble with this is because, and I realize this is probably very common. So this is why I'm sharing. For a couple reasons. I think A, how I'm feeling is very common. I think B, there was a lot I could have done to make this a more seamless experience if I had prepared in advance. And I'll tell you the whole story, why I didn't get to. And I want to share with you everything that I know about regenerative medicine on how this could have been just a much more seamless process for me. The results, not the surgeon's fault. I'm not upset with him by any means. I think he did a beautiful job. I just have gone through a whirlwind of emotions about this, and I don't like the way I look. So, but that said, if we're being transparent here, I never liked the way I look. I have been hypercritical of my appearance since I was a child, and it's something you can ask my mom. She's just like, doesn't know what to do with me. I'm never happy with how I look. I pretty much think, and these past few years, I just think I look old AF. Like I have been on the podcast circuit, as you guys know, and I go to different podcasts every month or so. And I've been doing this since April. And almost every single time I'm like, oh my God, the lighting is so bad. Well, you know what? It's not. It's me. It's not the lighting. I am 50. And while you may think I look fine here head on and you know, it's all good when you see me on social media, like in real life, I am not feeling like I look anything like I think I do. And so in an effort to try to improve my appearance and to sort of lighten the load, if you will, I was just feeling heavy. Like I was feeling like I get my grandma has the jowls and my mom has the jowls and I have the jowls. And then when you get too lean, you might look great for like a hot minute, but really you start to wrinkle up. So there's like this sweet spot where you have to keep a little fat on your body as you get older. Ladies, if you don't know this, being super rail thin as you get older does not make you look younger. Keeping a little fat on your body does. And so there's like this middle ground that you have to find and ride this line, but then I don't like the way my body looks and on and on. So anyway, all that said, I thought I'll have an upper bleph. It's not a terribly expensive procedure. It's a 45 minutes, half hour, 45 minutes in the office. It should be easy. Everybody seemed to rave about it. Everyone I talked to who'd had it done, which is a surprising amount of people actually, all told me, literally, they all said the same thing. Best thing I ever did. Such a super easy procedure. Not a big deal. And I just haven't had that experience at all. Like I look in the mirror and I think I look bizarre. I'm only 3 weeks out, so I still have scars and my eyelids are covered in ointment right now. So they're shiny. I don't have any makeup on. I have a little mascara on and that's it. And I'm not asking for anybody's sympathy. I just wanted to share this with you guys because I feel like hiding and I don't want to be on camera. I never want to be on camera, to be totally honest with you. I hate it. I hate having my photos taken. If you've noticed, much to all of my team members' dismay, the photos you see going around with me are me with my short hair from years ago. I hate having photos done so much that I have had 2 sets of photos done since that round, and I've thrown them all away because I hate how they turn out so much. So obviously this is my issue, and having plastic surgery solved nothing. And in fact, I feel worse about myself and the way I look entirely. So 100% wouldn't do this again. But again, this is no fault of my surgeons. This is my own issues in my head and my heart. And I'll go through this why. Number one, it was not as easy as everybody made it out to be. And I was shocked at how uncomfortable I was. Like I cut my eyelids off and then they stitch it up. And then I think I was having some kind of reaction to the suture material and I was super itchy. It was super itchy and swollen and very uncomfortable. I think part of that had to do with the fact that I did not get to prepare as well as I would have. Normally, when I prepare for a surgery or let's just say that I have not, knock on wood, I have not had any surgeries, maybe like a couple little skin lesions here and there. So when I prepare for something though, or when I prepare a patient, we go strict 2 weeks at least, if not a month, no alcohol, very little refined to no sugar, very low carb. We're trying to keep swelling down. And as women get older, we just tend to swell more. Raise your hand if you're a middle-aged lady and you've like stepped into your swelling years, right? So I'm in my swelling years and I swell up over everything. We can blame that on progesterone deficiency versus estrogen dominance. We can blame it on insulin. We can blame it on too much salt. We can blame it on all the things, but it's just is what it is. And it's like, some days you wake up and you look amazing and you're like, I ate like shit and I had a glass of wine. How on earth do my eyes look so not puffy? I'm talking before the upper bleph. And other days you wake up and like you didn't eat anything the day before that was even remotely inflammatory and you ate very little. And maybe you've been that way for days and you wake up and you're all swollen. I mean, it's just it's Russian roulette, right? It's total crapshoot with how the swelling of the eyes is going to go. Anyway, I tend to be more swelly prior to my period, to my menses. So I was right before my period. Emotionally, I'm always a little bit more fragile then, as we are. I'm in my like peak swelling week of the month. And I didn't prepare well. And that's because the eye surgeon got me in, great doctor. He got me in and he was able to get me in quickly for a procedure because they'd had a cancellation the next week. So I really just jumped right into this, and regretfully so. And this is one of the reasons why when patients would come to see me for regenerative injection therapies, I would make them wait at least 2 weeks before I treated them, because it takes time to gather your thoughts and to gather your supplies and to get ready. So at the bare minimum, I suggest, whether you're having something that you must have done, if it's not life-threatening or it's voluntary, give yourself 2 weeks between the consult or the initial appointment and actually having the procedure done. Give yourself some time to think and to prepare your body, to prepare your home. I would have probably done a big overhaul on the light bulbs in my house. It really got me realizing that I need to get more red light bulbs. My husband is an electrician and he built this house. And so there's recessed floodlights everywhere. And while I have successfully changed them all over to incandescent, that's a big step. We could put some red light bulbs in there, although those are unfortunately LEDs at this point. So I don't know. If you have some suggestions, hit me up with them in the comments, head to the YouTube channel. Tell me your red light bulb suggestions. Again, flood lamps. I have flood light bulbs, in recessed canister lighting. I would have prepared better. I ended up 2 days after having the procedure done, I ended up buying a wedge that, $45 on Amazon. It was overnighted. So I was able to sleep at an incline because you can't lay down flat. I would have prepared it around a different time of the month to be better in match with the down swelling time of my cycle. And I would have prepared my nutrition better. I would have prepared what I chose to put in my body for the 2 weeks prior, at least, if not 3, plus the foods that I was eating during. I kind of had to scramble. Thankfully, I had some bone broth on hand and I was able to, and my husband cooks. He does most of the cooking. So he was really great in preparing me food. But I felt like I needed to have a more variety of vegetables and probably some soups and just some easy things, right? Because eyelids are not, when you're an autoimmune girly like me, like that was a shock to my immune system and to my nervous system. And my nervous system is already sort of ebb and flow these days with every time I turn around, it's like I wake up, it's like damage report. Like some other, journalists are writing trash about me, disrespecting me, smear campaigns, people in my profession talking shit about me. Like it's just constant. It's been constant for years, but like when you put yourself out there and you start to gain some steam, you really take on a lot of haters. And so, I navigate that relatively well and I understand how it works. I actually look to Andrew Huberman, who is like a masterclass in not giving AF and just rolling with the punches, because the punches will come. However, that said, I don't think I was really it was not the best timing, especially this time of year. For any of you who are business owners, we're scrambling to make sure that we have our books in line and we've got all of our tax planning strategy dialed in, and we're making sure that we're getting things done. If you're a physician, for those of you who have to re-up your license every year at the end of the year, you're scrambling to make sure you have all your continuing education. Obviously, we're scrambling for the holidays and being around more people in general during a time of the year when people tend to be walking around as little petri dishes. So, there's just a lot going on there. And so I just didn't prepare well. So prepare, that would be step number one. Number two, don't listen to everybody. Well, take it with a grain of salt when people say it was no big deal, because every single person who said that to me, when I actually thought about it later, it was actually my podcast producer. He's like, have all those people had plastic surgery before? And lo and behold, yes. They all had breasts and face and all kinds of stuff done to them. I don't like fucking with my body. Like, I don't like it. I was a weird kid. I liked pain when I was a kid. Like, I used to pierce my own ears. I loved getting tattooed as a teenager, young person, when I was old enough to do it legally and start getting tattoos. I loved it. Had my nose pierced, had my ears pierced all the way up and around. Like, pain was not a big deal to me. But now, as I step into my menopausal years, if you will, as I'm heading there, I just want to be comfy. I literally, it's like a game for me to find the softest, most organic cotton, merino wool, the luxurious, linen sheets. Like, I go out of my way to have nice, soft things because I can afford to buy the things I want now. And I'm going to buy the softest, most high quality, beautiful, soft clothes. Heck, even just, going to the little market here in town. We've got something here called Buy Mart, which is just a small, it's an employee owned cooperative, really. And it's like, imagine like a mini rural Costco. And they have long johns in there, all 100% cotton, tops and pants and, leggings and tops. And I love them. I love being comfy and I hate being uncomfortable at this point. And I upgrade my flights so that I'm comfortable, and I upgrade my driving experiences so I'm comfortable. Everything for me at this point is about comfort because that calms my nervous system down and it keeps me chill so that I can do the good work that I need to do instead of having my nervous system all revved up. We can talk about that another day, but I came out of the chute revved up. It's a whole long story. So I didn't really like getting fucked with. I don't know how else to say it. Excuse my French. I didn't like having my eyelids cut off and sewn back together. Like, that wasn't fun. And it was a big deal to me. Like, it didn't feel like this, like, oh, no big deal. I think in comparison to having breast augmentation or any of that, that's like a huge deal. And again, like I said, I had surgery when I was 5 years old. I had my tonsils and adenoids out. I've never actually had and then like some skin lesions here and there biopsied, but I've never had like been cut into like that, especially voluntarily. So that part I didn't love, but that was just, again, my own headspace. Like, it's nothing, I think in the grand scheme of things, not a big deal. I've also had filler in my face, and way long time ago, like a decade ago, I had some put in my cheeks, which is long gone, but it freaking hurt. I didn't like it. Like, I felt like I got punched like 1-2 in the face. And I think, again, part of that was my immune system reacting. So depending on how your immune system reacts to things is going to dictate your comfort level after. And so yeah, just didn't love it. Didn't love that part. The other, I did do a few things that were solid. I have access to some regenerative therapies that can be used in the body to really help fortify. Obviously, I had peptides on board, and there's some oral peptides that I'll be sharing out about soon that are over the counter. These are supplements and really phenomenal formula that I utilized, and I loved it. So yeah, I had all my regenerative medicine available to me, and that was my background, right? For well over a decade for decades working with my mentor, but then in my own private practice for over a decade doing regenerative therapy. So I had some tools available to me that I utilized, and I should have rested the first few days and like done nothing. I shouldn't have been looking at a computer. I shouldn't have been looking at my phone. I shouldn't have been even looking at the blue light on the TV screen. I should have been wearing these, which I'll put these on right now. These are my Viva Rays. I don't have a discount code for you guys, but I love these glasses. These are yellow lenses. I should have been wearing these the entire time because what I was experiencing, I think not just eyelid swelling, but what I was experiencing was extreme light sensitivity because of the pressure from the eyelids on the eyeball itself. That was very uncomfortable for me. And I also realized far too late in the game, about a week and a half in, probably 10 days in, I realized I was dealing with dry eyes. And that was a huge part of why I continued to have swelling and discomfort. My surgeon was very, clear in the beginning to use lubricating eye drops if needed, but I didn't think I needed them because my eyes were watering profusely. And as soon as I could see again, I really was having a hard time seeing because the ointment you have to apply gets in the eye and it fuzzes it up. That was giving me tremendous anxiety. Not because I couldn't see, but like when I can't see, like when I don't have my readers on, I get super anxious. It's just my brain doesn't like it. So, having the lubricating eye drops, like when it clicked 10 days in, I was like, I think I'm having dry eyes. And I finally could read because my eyes were working well enough to read. I found some blog posts and some content online from other eye surgeons. And one gal, I can't recall her name, she was so great on her explanation of post-surgery instructions. She said, use the drops 5 to 6 times a day, even if your eyes are watering, even if you don't think you need them, because just like we have our skin barrier get compromised, you guys maybe have heard about that. Like when you compromise your skin barrier, you end up with all kinds of skin issues. Your eyeball barrier gets messed up in the process of the procedure sometimes. And so I think that happened far more to this eye than this eye. Plus, while you're sleeping, because of the swelling, your eyes might remain a little bit open and then they dry out. And I didn't know that. Watering eyes does not mean your eyes are lubricated. So using these glycerin, I specifically sought out glycerin drops that were preservative free, and they're harder to find. I think it was Bausch and Lomb. It was a bio something. It was the green bottle. They have a white bottle and a green bottle. Those have been super helpful. So I've been using those all day, every day since, and it's been way more comfortable. And as soon as I did that, I woke up and the swelling was virtually gone. So I think a huge part of my continued swelling and frustration was that. The other part was it aggravated my immune system. Like I said, my rosacea came back. Like it was trying to come back. And I was like, oh man, my poor immune system. So really having a lot of histamine responses, and I'm just a histamine girl. So making sure I take the appropriate supplementation for that. You guys that's different for everyone. That's a long story, but just making sure that I had my mast cells chilling out and my histamine response lowered and dampened. And that's partially the foods you choose to eat as well, right? And so getting that under control, that all really started to help things calm down. I'm still sleeping on an incline, so I'm still sleeping at about 30 some degrees, and I don't love that, but I finally figured out how to use pillows and such to get that comfortable. I think knowing what I know now, that wouldn't have been such a big deal. The first few days were really uncomfortable. So I'm like on my back hurts, my neck hurts. I just was ill prepared. I was just not feeling it. The other thing is you'll notice my brows look lower. They had to come out pretty far out of my eyes because I had more of an almond shaped eye with a pretty big overhang on this side because my orbit, I just went to the dentist yesterday, Dr. Kelly Blodgett in Portland. Amazing. My orbit, he does this 3D cone scan and you can see your skull and it's so cool. And my orbit on my right side is actually rotated and down, and this whole side of my face is bunched up. And so I chew on this side like 95% of the time. So I think that all this chewing and then tightening of the masseter I'm asymmetrical like we all are. But because this eye is turned down, then the lid was heavier on this side and there had to be more tissue taken off that eye. It was a heavier overhang. And so the excision had to come out quite far. So I'm still quite tacked down here. So I'm unable to get lift here without feeling like this is going to rip. So I'm waiting for it to heal more, and I'm going to start working a bit on that scar and getting some openness to the eye. I have techniques that I used to do in clinic and that I've taught to hundreds of doctors on how to treat scars. So I'm going to treat at least the lateral edge of my scar myself. And then all of my Dysport is worn off, which is like Botox. And I use Dysport strategically. I do my own Dysport and I use it strategically to give myself a brow lift. So you can actually hit these muscles here that scrunch in and you can have a bit of a lift because this frontalis muscle will pull up. And so I usually have a little bit of a brow lift. That's neuromodulators. And then I have this like sort of tightening down. So you can see when I lift, like this one wants to go up and this one doesn't because it's really tethered down over here. So that's something I'm going to have to work on. But that, again, he did what he needed to do to make things even and such. So I'm probably just seeing myself without Dysport. And I never like the way I look without Dysport. I am always like, oh God, I look haggard. So that's where we're at. That's where we're at with all of this. Some other things I would recommend. I am keeping petroleum jelly. I know. I have had my issues with petroleum jelly, but I have found that when I use a natural petroleum they have out there on the market that has castor oil in it, some of you may do phenomenally with castor oil. When I tried to apply castor oil, everything that was red got redder and itchier, and the castor oil in the eyeball itself didn't feel very good to me. So I am sticking to petroleum jelly. And I can say, aside from keeping my eyeballs lubricated, keep your lids lubed up. Keep your lids with the petroleum at all times. It's way more comfortable. They gave me an antibiotic ointment to use for 2 weeks. I think I was having a reaction to that as well. And I tend to have reactions to antibiotic ointments. It was not a Neosporin. It was I can't remember what was the active ingredient, but I do think that I probably over time between the sutures and that, my eyes weren't loving it. So as soon as things closed and the sutures came out, I waited another day or two and I started applying petroleum jelly, and that got much more comfortable for me too. So it's really finding what you have to obviously follow their instructions and use the antibiotic ointment. I'm not going to tell you what to do. I'm going to refer you to your doctor to do what they tell you to do, but the antibiotic ointment is going to keep you from getting an infection in those suture lines. And we certainly don't want that because then you're going to end up with everything really jumbled up. I also know that time is on my side and I'm probably still dealing with some edema. I ended up with a pretty bad blob of blood that came down on the third day. There was the edema here. He had to do a little bit more work to this eye. I ended up with this huge black eye on this side. I'm still dealing with a little malar edema, as they call it. So still dealing with that. So I think my face overall, what I'll say when I mentioned that my immune system got activated, my whole face and head swelled up a little bit. It wasn't noticeable to anyone else, but when I tried to put a hat on that normally fits me, I was like, oh, it's a little tight. So I was just having overall inflammation, and it was a reaction to me having my eyelids messed with. And so as that is receding and coming down, I'm feeling more myself, and I look in the mirror, I'm like, oh, I look more myself, but I really didn't recognize even down here, my face looked bizarre to me. It's still puffy. I'm still puffier than I was before I started all this. Interesting to note about the edema, the day after the sutures came out, you've got about 5 to 7 days. It seems in general, my doctor preferred 7. Day 7, the sutures came out. There definitely was some kind of immunologic reaction going on because the day later, whatever swelling was happening up in the eyelid area around the suture line came down with gravity, and my lower eyes, the bags were enormous the day after. Like basically gravity was pulling that edema down and out. So I'm just trying to work the tissues as I can. I am unable to actually do much even with my cheeks right now without feeling the pull on the lateral eyes. And so I'm being very gentle with my face and hoping that it will all come down. I still am not comfortable putting any kind of concealer on it. They say you can put eye makeup on at this point. I could not imagine putting anything on it. I don't want to put anything on it. The tissue's still very tender to touch and fresh, and I don't want any kind of infection or aggravation. I am a very sensitive girl. What I was getting at with the petroleum is I tend to have sensitivity to natural things. So when I did try to mess with them a bit and put on a more natural gel or balm or cream, and immediately my eyes were itchy or burny and my lids. And so And plus, then you don't know as it starts to come down while you're sleeping or while you're working, that can get into your eyeball, and you don't know if those are going to aggravate your eyeball. And so I'm just sticking for now to the petroleum jelly. Going back to the aftercare immediately as regards to screens, I think that I should have just laid at an incline for 3 days and like watched TV from a distance. I should not have been in front of computer screens. I should not have been trying to use my eyeballs. I should not have been trying to work. I think that was a terrible idea. The days that I did try to work, I would end up with this tremendous pressure and swelling, and I would have to ice, 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 ice. I should have used ice more. I honestly started getting lackadaisical on day 3 or 4, and I'm like, oh, I'll just do it twice a day. I should have been on that like every hour, just 5 minutes of ice even. And I'm not a big fan of icing injuries, but in this case, you get sometimes this swelling and pressure. It was very uncomfortable, and that would throw me off because then the swelling's pushing on my eyeball, which is like, feels like a pressure and an itch inside your brain. I did not like that part. So I'm just giving you the honest answer on all of this. I think I probably would have prepared better with some nutrient and mineral IVs. I think that would have been a good idea in advance. That can be a great way to prepare for any type of surgery to induce healing. I probably could have done with one after. That would have been a great idea. I probably should have had my hyperbaric oxygen chamber set up, which I don't have it set up yet here at the house, and I should have. I moved it and I didn't reset it up. I should have moved it, or I should have reset it up, but resetting it up requires me to lean over, and leaning over puts pressure on your eyes, and you're not supposed to lean your head down further than your heart when you are recovering from this. I have not lifted weights yet. I've done some gentle strength training. I really have taken advantage of my power plate. My power plate saved me. My eyes were so sensitive that even getting on my power plate for 1 minute was too much. And I had to go ice my eyes, even at like 10 days in. So I've been gently just using it to tolerance. And that might've meant 20 seconds. After I didn't do anything for the first week, but well, I shouldn't have been working. I should have been resting more, but you should just rest for the first week. I should have been down at least 3 days, I think. And then I could have gone back to, obviously, I think walking's, as soon as you can get up and start walking from any surgery, do that. So, walking and then resting in between the walks is what I'm trying to get at. And then the power plate, to tolerance, 20 seconds, 30 seconds, a minute. And I'm talking 7 to 10 days later. I'm not your doctor, so I cannot advise you. We're all going to have a different experience. I'm sure most of you won't even have this procedure done, but I know it's very popular and it's becoming more popular. So I wanted to make this podcast and video. Then I was up to a minute. I was up to 2 minutes. Now I'm up to like 5 or 6 minutes. And then I can actually do like step back lunges, squats. I can do a lot of lower body moves on my power plate, and that triple engine vibration. It's quite a piece of equipment. I will make sure in the show notes that we have the link to the episode I did about it last year, because it's mind blowing how well it works. But it induces, and we have data to show this, that it supports growth hormone levels naturally occurring. It supports bone density. It supports healing. It supports lymphatic movement, all the things we want, right? In this case. So really taking advantage of that. And then I do plan on going back to strength training this weekend, I'm going to a conference. And then when I come back, I'm going to try to resume my more regular strength training patterns that I'm in my workouts that I've been doing. The sleeping thing, I had so much anxiety, and I know that was me. I know that was just me up in my head. I was like, what have I done? I permanently altered my looks. I am not sure I like it. What have I done? Like I gave in to the beauty monster. I spent like 3 days just in this deep, deep shame, because I was like, what did I just do for the sake of beauty? Like, I'm adamantly against caving to societal's norms of what I should or shouldn't look like. And so there I was doing, I'm resistant to that. Like, if you're into that, that's totally cool. And I am not dissing anybody or having an opinion about what anyone else does. I do like a little Botox, and that's just because it makes me feel better. Like, I feel better when my face is fresher, and it significantly improves my mood. And we have data to support that, going back years, that it can really have an impact on neuromodulators. Getting rid of the grimacing heavy muscles can get rid of a lot of the low moods in people. It's pretty phenomenal. So interesting data there you can look up. But I just was kind of like, what have I done? And I voluntarily did this. And then my mom was like, but your eyelid really was getting heavy. And I was starting to see it. My eyelid, when I looked down, I could see my eyelid. It wasn't going to get better. Like I was going to have to do this at some point. It wasn't going to get better. And I don't want to be one of those people that's like lifting up their eyelids just to see. So whatever it is, what it is. But it was impacting my sleep is the bottom line. And finally, so I have a product called Chill Pill that's in my line of supplements. It's up there on the shelf. I just started taking that regularly, like all throughout the day. And what it does is it impacts your cortisol surge. So it just dampens that cortisol response. And it has some other great nutrients in it it's called Chill Pill for a reason. And I was utilizing that with my Relax Tonic. And I normally do that as needed. Instead, I just started doing it diligently twice a day and then adding in as needed, like a capsule here or there when I was starting to feel that anxiety creep in because I couldn't get away from it. Like my eyes were my eyes. I also couldn't go out. I couldn't do anything. And so I was sort of cooped up and having, you just get stuck in your head because you're stuck in your house and cabin fever, So I think I could have done a better job of maybe using some EFT, some tapping, although I guess I couldn't really tap around my eyes, but you can tap in different places on your body that aren't your eyes. And that maybe would have helped with lymph. I did do actually some gentle tapotement, we call it, just around here with very clean hands, just to kind of keep lymph flowing. And I think that was helpful, but I could have prepared my mind better. And it's just, again, that was my head. That was my headspace dealing with that. And I think the last thing so that impacted my sleep. And then the last thing that I would say is I don't know what my expectations were, but they're not met. And this reminds me of times in my life when I was sure, when I had the perfect body, which I have had like the perfect physique at different times in my life, and it did not make me any happier. And I've been super thin and cut and had great muscle mass, and it did not make me happier. And I have to remind myself of that. Like, what was I trying? What were my expectations aside from actual physical? Like, what was I hoping to get out of this, and being realistic about that and realizing that that's never the answer. The answer is in here. The answer is in here, right? So being able to settle in and just sort of like groove with my own vibration and sit where I had to sit to process. That's really where the work is always. I share this because you might be on a weight loss journey, or you might be on some kind of self-betterment journey. And you think when you get there, if you change your physical appearance, that your mental, emotional state will change. And I don't think that's necessarily true. Time will tell. We'll see. I mean, in 6 months from now, if I see myself on a podcast and I think, damn, my eyelids look great and they look happy and fresh, when you look happy and fresh, you feel happier and fresher. So that's really what I was going for. So we'll see. We'll give it a little time for the swelling to continue to go down. And that's going to take 6 months at least. And then get myself back on my Dysport. So I get my brow lift back on and look a little bit more like myself, and start to work on this area that's tacked down a bit. That's, it's hanging me up. I can't really get my eyebrow up. I'm used to this brow raising the most. So I'm just don't look right in the mirror when I look in the mirror. It doesn't look like me, like my brows are off, and that's throwing off my headspace. So I have some work to do. And this is part of it. I wanted to share and be transparent because I know somebody's going to be online and be like, what did you do? And I'm all about being transparent. I wasn't going to share it during. I know some people were encouraging me to, and I was like, F that. Like, this is nobody's business. But I do think that it might be valuable if at the very least you got something out of this episode in regards to how to prepare for any surgical intervention. Making sure your nutrition is on point, making sure you're well slept as much as you can be, making sure you're finding ways to mitigate that anxiety. We're going to have anxiety before. So I didn't sleep the night before. I didn't really sleep for 2 nights before. I was so anxious about it. Didn't sleep for the full week after. I think that none of that helped my headspace or my swelling or my healing. So finding tools, I should have really been on the Relax Tonic Chill Pill combo, a bit heavier, I think, for myself personally, not giving you guys medical advice, but for me, that would have been better. Finally, my husband pulled out some melatonin and was like, hey, babe, consider this. I actually upped my progesterone a bit. That was very helpful. So working with your practitioner to make sure that you have tools in place to mitigate your risk. And then if you're like me and you're a fidgeter and you like to move around and you like to exercise and you like to be active, then finding ways to be able to do that so that you can, that I think was what drove me the most crazy the first week, was I really couldn't do much without my eye pressure increasing, like the actual lids getting swollen and then the pressure back on the eye. And I was like, this is such a bummer. I just want to work out. I wanted to have intimacy with my husband. I wanted to do all the things and I couldn't do anything. And that was really epically frustrating for me. And I know many of you can relate. You've had surgery and you're like, oh, I'm stuck. And I know some of you are stuck for much longer periods of time. And here I am whining about it. But I wish I had mentally prepared for that. It was really my husband who came to me and he's like, I was bawling, you guys. I was like on day 6 and I had a complete breakdown and I was bawling. And my husband said, babe, you just had part of your body cut off. Like, give it a rest. Just let yourself be and heal. And then, of course, the next day I started my period. So I was like, oh, I wasn't going crazy. I just was PMSing. Do you guys ever do that? I've done that my whole life. You're like one day out of the month, you're like, I think I'm going crazy. And then the next day you start menstruating and you're like, it was just my period. So I will say I'm looking forward to that not being a part of my life. I'm right on the cusp of things shifting at 50 years old. Still very healthy cycles, but they're intermittent a little bit more. And so I'm looking forward to that part where I don't have to have that feeling of for like 24 hours of just, I either want to like lash out or cry. And that's not a fun place. It depends on the month, but usually that's pretty good. That this month in particular, I was having some symptoms of that. So I wish I would have just given myself a break. But then again, here we are. What did I say at the beginning? I'm never happy with my appearance. I don't ever give myself a break. And that's something I have had a lifelong struggle with. I hope that by the time I die, I can really learn to cut myself a break. But knowing that I'll just close with this. Healing takes time, and it's vitamin T, right? It's time. Healing takes time. And if you have a condition, I know this is something self-inflicted, but if you have a condition and you're frustrated with it, I'll share with you what my mentor has shared with me and what I share with patients is for every year that you've had something, it's going to take a month to put a dent in it. And that's working with a really good functional medicine or, longevity medicine doctor who really knows the comprehensive approach. It's going to take a month just to dent it. So the first 3 months that you're working with somebody, that's the heavy lifting. And that's where you're going to be putting in a lot of work, having to deal with a lot of changes, probably going through some grief as you shift and realize there's probably some foods or some habits you might have to give up or start to change the way you think about them. And that can be frustrating, emotional, depending on your connection to that thing, whatever it is, whatever that vice is. And so that first 3 months is kind of a tumultuous time. And then the second 3 months, you're more in the groove. Things start to feel more normalized for your body and for your habits and for your lifestyle. And you're starting to feel much, much better by then. So you're like, oh, this is really worth it. This is great. And then the third 3 months, it's usually a 9 to 12 month process when you're working with somebody. Because I get a lot of messages from you guys and you're like, I've been strength training for 3 weeks and I don't feel any different. I'm like, come back in 10 years. Stick to it and come back in 10 years. No, it shouldn't take that long, but it should take at least 3 months, if not 6 months, for you to even start to see a dent, depending on your health history and where you are. So it's a 9-month roll to really start to see the benefit of the work you're putting in. And so I have to remind myself of that right now too, is like in 9 months, I'll probably be really happy and I'll forget how awful I felt for the first week. But again, that first week was like just a conglomeration of bad timing. So all that, I hope this is helpful. Get the bone broth in, you guys. That'll help heal tissues. Vitamin C and zinc help induce collagen. Vitamin D is just critical for collagen induction and good immune responses. Good immune responses meaning we want an immune system working and we don't want it going haywire, right? So vitamin D, check with your clinician, obviously, on what the proper dosing is for all these things. I'm just sharing with you what induces collagen and induces healing. And then we love things that are going to mitigate the histamine response. So we love the NAC, keeping the wine and the histamine-inducing foods lower, right? That can really have an impact. And you may not realize you have a histamine issue until you unfortunately have to experience something where you're cut on or you're messed with like this, and then all of a sudden your histamine decides to explode on you, and it presents as mental emotional. First of all, please appreciate that. The histamine response, the robust histamine response definitely presents as a mental emotional. It definitely impacts your brain and your mood and how you behave and how you respond. And also how your tissues respond. If they're just flooded with histamine, they're going to get swollen and pink and red and itchy, and none of that's fun when you're trying to heal. So mitigating that, and then having some kind of mindfulness, making sure your sleep is protected, making sure you're around people who are supportive, making sure I would have food prepped massively in front of this and just had more of what I wanted to eat instead of just accepting what was served to me, although my husband did a phenomenal job. But there's prep work to be done. So don't walk into a volunteer procedure, whether you need it for medical reasons or you want it for aesthetic reasons. Don't walk into it unprepared, and then be gentle with yourself through it and give yourself time to heal and rest, and give yourself time to find out what the results are going to be. So we'll know, we'll see. You guys will be here if you're following me, and we'll see where I am in 6 months and 9 months, and maybe I'll do an update. But thanks for hearing me out. I hope this was helpful. I hope you guys are having a great holiday season. I've got a ton of podcasts that are all just situated around cortisol, pain, if that's something you're dealing with. I know December can be a tough time for people mentally, emotionally, physically, whether you're in cold weather, it really depends. So all of these things I'm mentioning tend to crop up. I've got a great one on how to prepare for upper respiratory season. I've got a holiday gift guide. I just put an episode out. Great gift ideas in there for your loved ones, all different price ranges, and tons and tons of podcasts to help you guys out. So you can actually head to your favorite podcast player. If you want to rate, review, and subscribe, it helps me immensely because it helps others see the show and we can get more of the truth out. And subscribing will get you whenever I drop a new episode each week, it'll get emailed to you. I believe it used to be that way anyway. And then check out the episodes, like go back and scroll. There's a ton of gold in these hills. So thanks so much for being here. I'll see you guys next time. Be well. Thanks for listening to the Dr. Tyna Show. This is a Wellness Loud production produced by Drake Peterson and mixed by Mike Fry. Theme song is by John the Guild. You can watch the full video version of this podcast inside the Spotify app or on YouTube. As always, you can email the podcast at podcast@drtyna.com. That's DRTYNA. And if you like this episode, please rate, review, and subscribe on your favorite podcast app. You can also find all of my offerings on my website at drtyna.com. For more shows by my team, go to wellnessloud.com. See you next time, and thanks for listening. This podcast is for general informational purposes only. It does not constitute the practices of medicine, nursing, or other professional healthcare services, including the giving of medical advice. I am a doctor, but I am not your doctor. No doctor-patient relationship is formed. The use of this information and the materials linked to this podcast is at the user's own risk. The content on this podcast is intended not to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.